arms towards the sun. You feel the warmth of the rays, and then you know you're alive and you don't have to be afraid.
Welcome to the Bassline, everyone. Ronald Owens Jr. is a medical freedom warrior. As a former employee of the California State Department of Health, he did his due diligence in alerting officials to the harms of mRNA injections. He was greeted with an unreceptive, bureaucratic stone wall. Undeterred, he compiled his findings in a book called Muzzled Truth. Here to discuss his book and his activism, I am joined by the more than commendable Ronald Owens Jr. How are you today, Ronald? Welcome to the Bassline.
Thank you for having me, and I'm doing great. Thank you for that very succinct introduction.
Oh, my pleasure. Now, first of all, before we get into our conversation, let me remind the listeners how you can support this program. This is a listener-sponsored program, so please go to my Substack, Jeremiah Hosea, Jeremiah Hosea. Look me up on Substack. Please subscribe to my Substack for free. If you can be a paid subscriber, that warms my heart, but do not let lack of income deter you from being a subscriber for free in the first place. Also, please go to jeremiahhosea.com. Check out my original music there. I produced some pretty awesome albums, actually. I have some pretty cool singles that are right there on the home page. It's all on one page, actually. You just scroll right down the page and check out the audio for yourself. And then, of course, I'm a chess instructor, so you can go to remotelearningchess.com and contact me there. My phone number's on the page. Or actually, just send me an email at jeremiahhosea@gmail to schedule your lesson. I teach people of all ages, all experience levels, and I would love to share the game of kings and the king of games with you. And also, of course, check me out on Twitter. Earth Driver, at Earth Driver is my handle. Slowly but surely building up my Twitter following, which helps us basically increase the audience for this program where we've had, as you know, phenomenal guests on a weekly basis. And this week is no different. We have a truly dedicated medical freedom warrior, a man I've had the pleasure of meeting recently, and now we've been in several Twitter spaces together, including just a moment ago, we were in a Twitter space having an interesting conversation. And I find this man to be very thoughtful, very dedicated, very insightful, and in general, Ronald Owens Jr., could you just take your time and walk us through your COVID experience? How did you start to come into consciousness about what was going on, from the lockdown to the masks and ultimately the vaccine mandate? Just take us through your evolution in terms of what your understanding was of all that was going on over these past 4 years.
Well, I will answer that great question in just 3 words: Tuskegee syphilis experiment. Between the late 30s to the early 70s, I believe it discontinued in 1972. The predecessor of the Centers for Disease Control and Prevention, and I don't remember the name of what CDC was called back then, they conducted this experiment on poor Black men in the South. And I thought that I read somewhere where they purposely infected these Black men with syphilis. I believe it was a total of 399. But I cannot find that anywhere. But according to the mainstream media account, these Black men contracted syphilis, and rather than being treated, they were just left to suffer. And so, having that knowledge, I just kind of knew to be suspicious of public health authorities. And when I came to the California Department of Public Health in 2009, I thought that our department was about doing good stuff that's going to benefit Californians. And I quickly learned that's not the case. So having learned that between 2009 and 2020, I basically was skeptical, very skeptical about what was being told us. And what was being told us was contrary to what the corporate mainstream media, I think you were the one that inserted that word corporate in a spaces that you and I were involved in.
Yeah,
We've
shout
all been
out to
saying,
Mark Crispin Miller for that one. Don't say
okay,
mainstream media, corporate media. Yeah, go ahead.
yes, I just didn't believe corporate media. And I was listening to those credible subject matter experts who were far smarter than I am, who were basically challenging that narrative. These people were censored, they were deplatformed, they were demonetized. A lot of reporters were demonetized. And in some many cases, a lot of these doctors lost their licenses, they lost their practices. And those are the credible subject matter experts that I was getting my information from to confirm my suspicion that this COVID 19 was nothing more, nothing less than a flu, which didn't necessitate locking us all down like we were prisoners, socially distancing ourselves, poking our noses with swabs to determine whether whether we had COVID or not, and ultimately administering a quote vaccine. I'll use the word vaccine in the vernacular that I was dealing with in public health, but I do not think it was a vaccine. So yes, I was suspicious, and because of my suspicion, I just didn't accept that everything that was being told, and it was basically based upon the three words Tuskegee syphilis experiment. That's encoded in a lot of our Black people's cultural DNA.
Absolutely. And, on the subject of Tuskegee, one thing that really troubled me about the way it was mentioned in the whole power play to get everyone to take these shots is it was dealt with or discussed as though it was, this old folklore and that's the way things used to be. But we're so much further along than we were back then. We don't do those kind of harmful things anymore. So, it's like almost like you're being superstitious to reference that. That was, the Salem witch hunt or something. We don't live like that anymore. But no, it's actually been an ongoing lineage, unfortunately, of this type of diabolical behavior on the part of medical authorities who, you know, we should be able to trust, but unfortunately we can't based on history. But I would love to get into your book because one thing that is a personal theme of mine is I really believe that when people take the time to do things like complete an entire book, we should really support those kind of efforts because it's one thing to have a good idea. That's great. It's one thing to make some good comments. That's great. I I think, hey, sorry to pat myself on the back. I'd like a little bit of credit for having written some good articles, but even more substantial than an article is you took the time to write an entire book. So please tell us what compelled you to write this book. What was your creative process? If you could give us a little bit of insight into that, how did you just actually go about writing the book? And what's the overview? What's the synopsis of the book?
Well, I think I answered the synopsis first. I'll be very pithy. I informed the management at the California Department of Public Health. That was what they call a public information officer. The PIO deals with the media. So we're supposed to know how to write. So I informed the management in writing that properly dosed ivermectin can cure and COVID-19 vaccines kills. That's what my book is about. Now, I started to write when I was probably in high school. I had a very bad speech impediment. So writing was my outlet. So I gravitated, wasn't very good in math in schools. I gravitated toward writing, toward journalism, toward English. And I chose the career path, that particular career path. I got a BA in government journalism at Sac State and graduated in 1986. And I worked at the California Newspaper Publishers Association for more than 5 years between 1987 and 1992. And that was a great experience because it allowed me to learn. I learned more from that experience than I did in college. My audience were the publishers here in California, the editors, the newspaper executives, the advertising folks. Those were my audience. It was a trade association publication, and I put together a newspaper every month, 56 total editions, matter of fact, during those 5 years. So writing became more second nature. And then I started rewriting portions of the Bible in newspaper format. I rewrote 10% of the Bible newspaper format, and those 7 Testament Spectator editions are available on my ronaldfowensjr.com website. And from that, I started to write Bible stories in the first person. I put myself in the sandals of Noah and told his story. I put myself in the sandals of Judas and explained why I betrayed Jesus, how I betrayed Jesus, and the consequences of betraying Jesus. So I started to tell Bible stories in the first person. So when COVID came and everything reached a climax, when I tried to warn them that properly dosed ivermectin cures and COVID-19 vaccine kills, I put myself in my own shoes and told my story. And it was a very cathartic experience for me and a very informational experience for those who read my book because I basically tell the story from me, what happened when I warned management that properly dosed ivermectin cures and COVID kills. So when things reached a climax in August of 2023, I remember going to the hospital because I felt chest pains, and this is all in my Muzzled Truth book. And they ascertained that the heart pain that I felt was not blood clots in both of my lungs as it was diagnosed 4 years earlier, but it was probably just induced by stress. The day after, I remember walking around the pedestrian track not too far from where I live, a nice park, and I just took my iPhone and just basically spoke into a transcription app and just recounted everything that happened up to that point, and that was the basis of my book. On this basis that we were at previously to this interview, I encourage everybody has a story to tell what happened the last 4 years. Everyone has a book to write. If you don't think you can write, all you got to do is get a transcription app on your smartphone or your iPad or tablet or whatever, and just speak into it and let the transcription come out. And you can take it to somebody, and they can make it up
Or
to the
flowery.
code. Exactly. That's how you can tell your story, because if we don't tell our stories, Jeremiah, it will be forgotten. So anyway, back to your question. I'm glad that I do have the ability to write because there's this movie, this Denzel Washington movie called John Q. Yes, I almost forgot. And basically, he plays his father whose son has some sort of heart condition, and he's getting to run around from the hospital. And so he takes matters in his own hands, and he basically holds the emergency room patients and doctors and nurses there hostage to make a point. I'm saying that to say that I was fantasizing about that movie, and I'm thinking, no, I'm that's not the kind of person I am. God, I don't know how to defend myself physically. I haven't taken boxing before or martial arts. Don't know how to load up a firearm, but I do know how to write. So the writing was informing you, the reader, but it's very, very cathartic for me, the writer.
Yeah, I know the feeling. It was a great feeling to just organize my thoughts, put them down on paper, considering all that we've been through and all these various modes of social control that we were subjected to. It was just, yeah, it was quite therapeutic, I must say, to just sit down and say, hold on a second here. This didn't make sense, what we were subjected to over here and over there. And yeah, it's definitely uh, a reward unto itself to complete a written work. You're a very active man. I've seen you in some videos testifying, it appears, speaking before bodies. You done some activism with a previous guest of this program, our mutual friend Julie Three, and I'd love for you to describe your activism. Basically, how do you go about uh, knowing when and where to appear, and describe some of these events and what do you have coming forward? What do you have forthcoming in terms of your activism and your your on location activism, not just writing and not just speaking on Twitter Spaces, but showing up before official bodies to express your concerns and your findings.
Well, I appreciate giving the opportunity to share what I am doing. It's a mission, and basically, I came out, retired December 31st, and I immediately incurred a 55% pay cut. The difference between my monthly salary, which was low six figures, and my pension. Now, part of that was absorbed by pulling Social Security, which I ultimately had to do. I didn't want to retire when I did. I wanted to wait at least after the election. I didn't want to pull Social Security when I did. But with the knowledge that I knew, if I had stayed at the California Department of Public Health, I would have been complicit with committing crimes against humanity. So I did the right thing. I retired, wrote a book, launched a book, spoke, between January and probably April or May, very small groups that were friendly to the message that I was bringing. I really would have liked to have appeared and convince as many people as I could that these COVID-19 vaccines are dangerous. But anyway, I was asked to speak at small political groups. I met Sacramento County Board of Supervisor Sue Frost. That woman is a hero. She and I connected latter part of April. I started going to the Sacramento County Boards of Supervisors in May. And I think that the exact date was probably May 21st, if my memory serves me correctly. And I appeared there a total of 4 times. And I didn't know that while I was going there, that I was beginning to hone in a message that would be replicated throughout the state of California. So I appeared there 4 times. I crafted a 5-page memo. 2 of the pages are actually sources. So it's actually 3 pages of solid narrative stating what Javier Becerra said on April 14th, 2022. And this is the main premise of my book. Secretary Becerra was a guest on a White House convening on equity summit. And at the 45-50 mark of this video, he said, quote, "We know these vaccines are killing people of color, Black, Latino, indigenous people at about 2 times the rate of white Americans." I learned that in April of 2022. I prized my management of this several occasions between 22 and 23, and they basically didn't want to listen to me. They kept saying this is my personal belief. They gaslit me. They tried to say that Javier Becerra wasn't that he misspoke. And so that's the message that I was communicating at the Sacramento County Board of Supervisors. And then I crafted that 5-page memo, and I included in that 5-page memo what Javier Becerra said, when he said it, where you can listen to it yourself, because I leave the YouTube link. And by the way, I checked just yesterday, and that White House YouTube link is still on the White House's website. And I tell who I am, what I tried to do to apprise my management about the dangers of COVID-19 vaccine. I cite studies in Italy, Japan, and Germany. I cite the Health and Safety Code 101025, and that Health and Safety Code essentially states it's the duty of the Board of Supervisors to do stuff to protect the public health. So I sent out my first memo to the Sacramento County Board of Supervisors on July 23rd. Okay, so between July 23rd and July 29th, I served to all the 57 other boards of supervisors, copied their individual email addresses, posted in the notes section of my iPad to 291 additional email addresses. And in some cases, I included or copied the clerk of the board and the assistant clerk of the board. And I created 56 additional files. And so as a writer, I like perfection. So I would read what I wrote and I saw, oops, I forgot to put the date. So I had to put the date 56 times, okay? Because each file was addressed to a particular board of supervisor name. Oops, I need to adjust this phrase or transpose that phrase. And then I had to do that 56 additional times. And I think I made a total of 4 edits. So 4 times 56 is 224. So had to make 224 separate edits before I sent out that document. And even to this day, there's a phrase in there that, oh man, I wish I had to rework that, but it is what it is. Sometimes you just got to roll with it. So I sent out that information on July 29th. So basically, every elected board of supervisor in the state, there's a total of 296, have been apprised by me about the dangers of the COVID-19 vaccine, about what Becerra said, about the studies in Italy, Germany, and Japan, about other instances where there are people who have been injured. And also, I cite as source 16, and this is a person that you might want to connect with, is Jennifer Sharp. Jennifer Sharp produced a very good documentary called Anecdotals.
Oh
And
yeah.
and for those who don't know, have not seen that documentary, it's basically people who took the vaccine, they can't take the booster, they can't work, and they're being gaslit and being disbelieved and being maligned. Anyway, that's my 16th
Mm-hmm.
source. So I included all that information, sent it out July 29th. Now I'm following up in person by appearing before boards of supervisors across California. There are 58 boards of supervisors, and I've appeared on Sacramento on May 21st, June 4th, July 9th, and August 6th. San Joaquin and Stockton on August 13th. El Dorado and Placerville on August 20th. Yolo and Woodland on August 27th. Solano and Fairfield on September 10th. Santa Cruz and Santa Cruz on the 24th, Alameda and Oakland on October 1st, and I hooked up with Julie Threet and Diana Dries there in Butte County on October 8th. The next week, Julie Threet accompanied me to Colusa on October 15th, and then I appeared in Placerville on October 22nd. Julie Threet called the Marin County Board of Supervisors when they had their meeting on October 29th. And by doing so, that delayed me, that allowed me to get there in time because I was running late. Traffic is horrendous here in California. And then I appeared in Santa Clara Board of Supervisors yesterday, and I will be at a county next week. So I have gone to 12 counties doing my due diligence, doing what the California Department of Public Health should have done way back there in 2022. So I've appeared in person at 12 counties, and I've got 47 counties to go.
Wow. Well, that's really exceptional. And I really commend you for what you're doing. If we had more people stepping up to that extent, we could achieve a lot of our goals much faster, I would say. I would love to hear from you, although I shouldn't say I would love to. I'm kind of scared to hear what you're going to say in response to my next question. But I would like to hear from you, your own account, your own observations in terms of vaccine injury, because I think there's many metrics by which we can notice that serious harm has been inflicted. We have the excess death numbers. We have the work of someone who was just in the Twitter space with us, former guest of this program, John Baudouin, author of The Real CDC. Everyone, please go to therealcdc.com. That book is a phenomenal book. It's the record level data. He's really breaking it down like this is what started happening. This is what is being observed, although not responded to, but observed since the vaccine rollout. I know many people who have serious new health problems since receiving their injection. Of course, I can't medically confirm in every case that it's certainly the shots, but the timing is more than suspicious. And there's so many people that I can think of. For example, I know 3 world-class guitar players with serious medical issues since their shot. 2 of which have heart issues, another person who has prostate cancer. Then I know of a few other people with prostate issues. That's not something I've actually heard of a lot in terms of vaccine injury related to these shots, but I've seen it in my own personal life. Again, I can't medically confirm that, but they have medical issues they didn't have before their injection. Cases of anaphylaxis, even things as simple as someone who has beautiful skin, never saw as much as a blemish on their skin, having a severe rash to the extent that they were hospitalized for a skin condition out of nowhere. Just all these little things. A neighbor of mine saying her cousin had a heart attack shortly after her shots, and on and on and on and on and on. So from your personal perspective, from your subjective experience, what would you explain to someone if they said, well, what do you mean COVID vaccines are harmful? What have you noticed? What proof do you have that they've harmed anyone? What would you say?
Well, before I answer your question, I want to state something that happened yesterday when I went to Santa Clara Board of Supervisors. I have a motorcycle, what's called a Can-Am Spider. It's 2 tires in front, 1 tire in back. Really cool. Anyway, I rode more than 100 miles yesterday, and I know it's not about me, but a lot of other people who went to this Board of Supervisors meeting yesterday, they took the time out of their busy schedule to appear there. So one of the Board of Supervisor members has been termed out. Her last meeting was yesterday. And I believe about 10 o'clock, probably till about 11:15, it was expended giving accolades to this Board of Supervisors. Okay, this person is probably a great person, I understand. All right. Now it came time for us to make public comment. We were allowed to speak just 1 minute. Just 1 minute. And I have thought about it since then. And probably it's good that I didn't analyze it, but I'm thinking because I need to stick with my script and not go off topic, especially if I had just 1 minute and I had 1 minute to make my pitch. But I just think it demonstrates the tone deaf and the elitism of our local elected officials where they allow themselves ample time to comment about someone who was voted in office and probably earns six-figure salary. This particular person has 6 or 7 on their staff, but yet we only get 1 minute. And the information we're sharing has to do with convincing them to let their residents know that these COVID-19 vaccines are killing people. Anyway, I just wanted to make mention of that. And I will probably make mention of that when I do my report next week. Because every time I go to a board of supervisor, I talk about where I was and about my reflections about what I think. It's kind of like a video blog. Answering your question, number one, I was naturally suspicious that when you are forcing people, coercing people, cajoling people, threatening people to take something that we don't know what's in it, that to me is problematic. And I am not the smartest person on the planet, but I know that there's something with this quote vaccine, close quote, that doesn't feel right. And I was naturally suspicious because of Tuskegee. And in the years that I was at public health, I saw the stuff that they were doing that was promoting public health, but it was not public health at all. It was fulfilling either a political agenda or responding to the mores of the day, which, my humble opinion, I don't think people should get tattoos, but I think it's a responsibility of the public health department. If you do get tattoos, you should, this is, are some of the risks. That kind of information was not, I want to stay in my lane, but I don't remember seeing that kind of information. So answering your question, I'm not a doctor, but I have common sense. And my common sense tells me that this COVID-19 vaccine is not to be taken. And I was hearing all these subject matter experts confirming my suspicions, people who were a lot smarter than I am, more educated than I am, and was telling us, no, don't take it. And then I know how to research. I found the vaccine adverse event reporting system that showed that there are people who are essentially getting injured by taking these vaccines. And matter of fact, there are 10 categories, and I have noted those 10 categories in my 5-page PDF. And you know that one of them, anaphylaxis. And I like to desemanticize words. I think that's like facial paralysis. There are people who've had strokes, seizures, sudden deaths. There are pregnant women who have been affected. There are people who have had heart inflammation and heart attacks. So by breaking down those 10 categories and 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 desemanticizing it and explaining it in layperson's term, it resonates. But yes, that's the answer to your question is basically common sense, and then listening to other credible subject matter experts who would be deplatformed, censored, demonetized, sanctioned, decertified, and they had more credibility. Physicians who actually treat or have treated patients rather than a doctor in the bureaucracy or in a local health department. To me, you need to listen to those physicians who had the courage to basically tell us what's really, really going on.
Yeah. And one thing I pointed out in regard to the dissident doctors is they were so much more clear than the authorities that were steering us towards the vaccine. They were being detailed in their concerns. And then I was noticing that you present these concerns, and often it's responded to with character assassination, trying to say, oh, that person is a quack, or that person is not credible for some reason. And I didn't find it credible their claims that some of these people were not credible because the people were speaking in such clear terms and they didn't come across as crazy at all. They came across as thoughtful and detailed. And, if someone expresses a medical concern, I want a response to that concern they're expressing. I don't want to hear a random insult of that person. That makes me more suspicious of you, the criticizer, than the person who's trying to issue a health warning that either they're correct in what they're saying or maybe they're incorrect. But when you insult people, I don't think that makes you more credible. But this was being used just so flagrantly in terms of smearing the people who were saying, hey, let's slow down with this. Hey, there's some concerns here. Hey, there's a body of work saying lipid nanoparticles can cause thrombosis and other harms. mRNA has unresolved health concerns associated with it, et cetera, et cetera, et cetera. Uh, so that's something that just struck me throughout the whole thing is the dissidents, the people who were being discredited were so much more detailed and clear than the people who were steering the public and trying to discredit these individuals who were simply trying to warn us that what was going on was not safe. I remember a quote from Dr. Robert Malone, which is, I think, a very powerful one, where he just simply said, public health authorities are playing fast and loose with public health. But I would love to hear from you, considering your dedication and considering that you're very involved in the community of medical freedom activists and you're in communication with the vaccine injured, and you're showing up on location to address these issues. What would you describe as the essential goals of the medical freedom movement? What would you like to see us focus on, and what would you like to see us achieve as a movement?
Well, my ultimate goal is to just basically just eliminate vaccines, period. I've never been a father, but if I ever had a child, I believe that the best vaccination is breastfed. That's just my opinion. And anybody who's on the fence, I would encourage you to read the complaint that a Dr. Richard Fox, he's a physician, specifically a pediatrician, and he's an attorney. It took him 6 months to draft this 100, I believe, 154 page complaint. He filed it on August 26, 2024, with the U.S. District Court, Eastern District of California. And the 7 defendants that are named, and I talked to him a couple of days ago, and they've changed the defendants. But if you go to the website where you can read the lawsuit yourself, it's the Stop the Schools Shots website. And I can text you the link. You can include that so people can read for themselves. If you read that lawsuit, let me start by saying, if you're on the fence, and if you read that lawsuit, I believe you will be convinced not to ever vaccinate your child again. Because the lawsuit essentially states that Congress, CDC, FDA, Big Pharma, they know and have known that these childhood immunizations are dangerous. But because of the censoring and because Big Pharma pays a lot of ad money to corporate media, people, particularly parents here in California, have not been informed. They have not been apprised about the dangers of these childhood immunizations. Dr. Fox told me that he would conduct a physical on a child who was unvaccinated and never see that child again. And I'm wondering, all these ailments that we have, I've had skin problems all my life. My hands break out, areas of my body breaks out like a rash, hydraulic eczema. Is that because of a vaccine injury that I took many, many years ago? I don't know. It's like the business model is to create a permanent customer base. It's all about making money. It's not about public health. It's not about preventing diseases. And I've learned a lot from you since our association on X. And one of the things I learned, and I think I probably heard this before, but you reiterated it. And you know how sometimes we hear something and initially it doesn't like ring the bell, but we need to hear it from
Absolutely.
somebody else
Yeah.
sometime later. You said that what really stopped, and I forgot what disease it was. Correct me if I'm wrong. Well, tell me what disease it was. It wasn't the vaccination. It was basically good hygiene. People washing their hands. People indoor, plumbing. That's more better. Please help me out. What
Polio.
disease was it polio?
Well, the polio vaccine is what pro-vaxxers love to hang their hat on. And
Uh-huh.
what I point out is that if you look in the history of that, there's something called the Cutter event. And that's just mainstream history where they say, oh, yeah, there was this one bad batch. It was basically an industrial accident. Well, okay, let's include that then. And let's not just marvel at this wonderful accomplishment because, well, what if you're one of the people who got the bad batch and you're crippled for life now or you're killed? So it's interesting that they take such a flawed example as their gold standard example. But then I can't stand this reasoning because of the supposed success of the polio vaccine. Therefore, you need 82 injections before you're 18 of all various sorts of injections. So, not everything is equally good, not everything is equally necessary. Please don't use the polio vaccine then as the grounds for needing to inject my child over and over and over again for this, that, the other thing, and the next thing.
Well, I asked this question in my Muzzled Truth book, rhetorically, of course. Would any adult want to subject themselves for the next 18 years of their life to take between 72 and 80 vaccines and boosters? I don't think so. I don't think so.
I agree. And, I'm really thinking, and this is just from my gut, honestly, again, I'd make it very clear, I'm not a medical professional, I'm not a scientist, I don't make public policy. Um, I'm not looking to administer medicine, but I will just say through my general inquiry into these matters, I'm really wondering if we can start to engage in a new type of healthcare that does not involve any collateral damage whatsoever. It's really
Thank you.
disturbing how we accept this implicit degree of collateral damage and are very non-specific about how much collateral damage are we referring to, and it's as though those rare cases, and what an unscientific word that is from the science zealots. Well, it's rare. Well, what does that mean? It's not rare if you're the person who got it, or sometimes rare might be rare compared to a bigger number, a bigger denominator, but it's not rare in terms of, well, it's a really substantial number of people, however. So, is there a way that we could stop doing all this rolling of the dice with our health and say, okay, if you're healthy, let's fortify that health. Let's do preventative medicine. Let's do things to continue to improve on good health as well as we can, and not, um, this collateral damage sort of roll of the dice approach. And sometimes I wonder, it's like, well, you never get really clear percentages in terms of, well, what am I being protected from? What are the odds of me catching this thing? It's like, take a 1 in a million chance to prevent a 1 in a million chance of injury. Well, how about I just get left alone and we just keep it at zero?
Okay, so what is your question again?
Oh, that wasn't a question. That was
Oh,
just a
okay.
statement.
Okay.
But I guess the question that I was asking before, I guess you could add to it, is
Uh-huh.
goals for the medical freedom movement. What should we
Okay.
be shooting for in terms of, we're protesting, we're writing articles, we're trying to make people aware. What should be some of our fundamental goals?
Well, I think that we need, and I think the climate is
Yep.
conducive for
And I know you
making,
said end all vaccines, by the way, so you started
yeah,
there. That's a nice, strong place
it
to
is. Yeah.
start. And I agree with you, by the way, but go ahead. Sorry.
Working backwards, inform people. about the ills of COVID-19 vaccine, about the ills of childhood immunizations. And I think that the 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 election is going to make it conducive for those voices to finally be heard, giving voice to the vaccine injured, giving voice to whistleblowers like me and others, giving voice to those who witnessed what happened last 4 years with hospital protocols, with social distancing, with the ineffectiveness of masks, with the shutdown of businesses and destroying people's lives. So hopefully all that will be discussed and talked about. I think as a retired public information officer, and even though I'm retired from the state, I took a oath. I swore an oath to defend and protect the Constitution of the United States and the state of California when I became a state employee. And as a public information officer, I may have retired on December 31st of last year, may have incurred a 55% pay cut, but I still believe that my oath is in effect. And I am informing the public. And answering your question, I believe that God put me where He put me to do what I'm doing beyond my employment with CDPH to inform the public. And I believe that the future administration will provide that climate to um, to do so.
Well, normally when we have a live program, we try to take a call or two at the end of the show, but uh, one advantage and disadvantage of the pre-recorded programs like the one we're doing now is, well, we can't take calls from our esteemed audience. But the good news is we get an extra few minutes to talk and go over some things. So I would actually love to hear, because I've heard you make some insightful comments about it. Let's just go back to that one little feature, because I realize, I haven't written an article about this yet, but I should tackle this because there's a lot of little stuff in there. It might bore the heck out of some people, but I still think it's rather relevant to discuss the absurdity of masks. I know you weren't very fond, as was I was not very fond of masks. I wore one at one point or another, I must say, just that's what we were told, and I was a little skeptical of it, but I wasn't the guy saying, "Well, no, I don't want to wear a mask." I said, "Okay, well, I'll wear it." But as I looked into it, I realized it's bogus. And I noticed it was interesting before I actually took my mask off and said, I'm just not doing this nonsense anymore. I noticed how people were getting so agitated by me just questioning the mask. Even I said, wait, but I said I'm wearing it. I didn't take off my mask yet, but I just am researching it and I don't think it's beneficial. I think we should consider the possibility that it's not beneficial at all. And I saw how certain people got so uh, irritated by me questioning this mandate. So what's your take on the mask thing?
Well, I wish I had have quoted Dr. Fauci in my book regarding what he initially said about masks. I was putting Muzzled Truth together very, very quickly, and I wish I had made that calculated decision. But I remember what a Dr. Ramin Oskui, he said this in July of 2020 on Fox News. Quote, "It's simple. Does your chain link fence stop a mosquito?" That's mask right there.
Right,
Um,
exactly.
I don't say this bragging in a braggart way, but I never put on one of those blue face masks. I've always thought that they were an instrument to enslave, and I didn't want to subject myself to be enslaved. So I never wanted to feel the fabric press against my lips, suffocating my nose. I never would have felt that string wrap around my ears because wearing glasses all my life, I've had the glasses part, I guess that's called a tempo, that or that wraps around your ear, whatever that part is called in your glasses. It has protruded in my ears before, and it hurts if the glasses aren't adjusted properly. So having that experience throughout my life, I thought that wearing a string around my ears, that's going to hurt me. I'm not going to do anything that hurt me. That's just that's just common sense, human, self-preservation. So now I did buy a face shield. That's probably worse as I think about it. But I bought a face shield because to allay my mom. She was dying of cancer at that time. And she said, Ronnie, if I'm in the hospital, um, I need to be assured that you'll be there for me. So I went out and I got a face shield and I wore it about maybe a half a dozen times. And each time I put it on, it was hard to breathe. It really was. I felt a little bit, my anxiety level rose. But yeah, for the most part, actually, no, not for the most part. I did not wear a face mask at all during COVID. I would have to kind of play this angry black man vibe. I put my sunglasses on and I would walk into a store that had face mask signage, and I just like I'm 6'2", and I guess I command some sort of imposing presence. And I just basically exuded the vibe. Don't talk to me. Don't mess with me. Don't ask me about the mask. If you want to wear a mask, that's your prerogative, but don't expect me to. I remember walking through Lowe's. That's one of those stores where you get home improvement material. And these two black women were whispering as they looked at me walk by. They had both had masks on, and I was walking through with my sunglasses. Another woman in a grocery store, she looked at me and she said, the sign says that you need to wear a mask. And I proceeded to respond to this quote about does chain link fences stop a mosquito? And said, wait a minute, I'm not going to go there with her. I just basically said nicely but firmly, it's none of your business. And when I said that, there was a man with a couple of kids. They didn't all mask, and they smiled and waved at me. I didn't see them, but we were the only four people that I saw that day in the store without face mask. As a motorcycle rider, sometimes I would walk in the store with my face helmet on. And the helmet I had at that time had a reflectorized thing. So you can tell what I look like. I had that face shield down. It was reflectorized gold. And so I walk in there, not necessarily to avoid confrontation, but as a motorcycle rider, sometimes you just rather than take off your helmet and put a hat on or comb your hair, put your helmet away, it's just easier just to walk inside the store with the helmet on. And I took advantage of that particular situation by lowering my face shield. So yeah, I just basically adopted what Dr. Ascui said, and I think he has died since then. He basically said, it's simple. Does your chain link fence stop a mosquito?
Right, I remember that analogy from Dr. Buttar, the late Dr. Rashid Buttar used that analogy, chain link fence to keep mosquitoes out. Um, so I would like to make sure, because we are nearing the end of the program here, I would love if you take the time to spell out slowly and clearly every way in which people can follow and keep up with your work. Where can people order your book? How do people find you on Twitter? What was the website that you mentioned before, your personal website? And anything else you might want to mention in terms of people keeping up with you, supporting what you're doing. Please, everyone, grab a pencil. My guest is about to share some links with you. So please go ahead and tell us how we can keep up with your work.
I would start with muzzledtruth.com. That's my website. I appreciate anybody who would buy my book from Amazon or Barnes and Noble in paperback, ebook, narrated by yours truly. I would appreciate that. But people don't have to. all they have to go to muzzledtruth.com and go to the CDPH rejected COVID-19 treatment and vaccine warnings button and read the 62 pages of emails between me and management. In my book, I purposely did not name the players in Muzzled Truth, but those emails that are posted on my website, which is subject to Public Records Act disclosure here in California, you can see who wrote what and when. I also want to say, I want to digress just a moment. I have also posted on my muzzledtruth.com website how you can send to your local public official COVID-19 shot warning template. Click to view, and there's the five-page PDF. The 2 is blank, sent on behalf of Ronald Owens Jr., retired information officer to California Department of Public Health, CDPH in parentheses, and Ronald at muzzletruth.com email address. The subject, COVID-19 vaccines are killing people. Federal health chief said, and you can pencil in the date, and you can send to your local political official anytime, anywhere, this particular document on my behalf. So so muzzletruth.com is my website. My other website is ronaldfowensjr.com. I've indicated that I've rewritten about 10% of the Bible in newspaper format. It's called the Testament Spectator. So I've written Testament Spectator editions on Moses and the Exodus, Joshua and the Jericho conquest, the life of Gideon, the life of Samson, the edition on First Samuel, which is David-centric. That's the entire book of First Samuel, Jonah, and a 48-page, 125 story in the life of Christ. That's my gift for people who visit my website. They can download any of those PDFs at no cost, send the PDF to the printer, direct them to enlarge it on 11 by 17 paper, back to back, staple it, and they can read the Testament Spectator as if you're reading a real newspaper. Then I have 5 books, 5 paperbacks, 5 ebooks, and 4 of those books are also narrated by yours truly. That's ronaldfowensjr.com, muzzledtruth.com, and I'm on X at Muzzled Truth 1. That's MUZZLEDTRUTH 1, numeral 1. And by the
Excellent.
way, I do have a Facebook page that I'm getting shadow banned, but my Facebook moniker is Ronald F. Owens Jr. on Facebook.
Oh, great. So yeah, please, folks, support this work. Download those free books. Partake in the writing. Partake in the information, and consider buying the Muzzled Truth book for yourself. Buy it as a gift. If you know dissidents, critical thinkers, get them a nice, unique, original gift that they may not have even heard of before. And I'm
Jeremiah, if
sure
I
you
can,
know someone who would
Jeremiah,
appreciate it.
yeah, if
Go
I
ahead.
can gently correct, it's the newspapers are at no cost, but the books
Oh
on
yeah,
some of
by
the
all
books,
means. Yeah,
yeah,
no, absolutely. Understood. So yeah, please
okay.
buy the book, Muscle Truth, right? It doesn't publish itself. There are expenses involved in that, and it's really worth supporting. And you can help encourage Ronald in his tireless activism. And we are out of time, but I want to thank you, my friend, Ronald Owens Jr. Keep up the great work. I look forward to getting a copy of your book myself, and looking forward to talking with you again soon on Spaces and elsewhere. And yeah, my congratulations to you for all that you've done so far.
Thank you. And I look forward to coming back and reporting to your listeners that a board of supervisor here in California took the stand to stop promoting, administering, and distributing COVID-19 vaccine to its residents. And it happened in Idaho, just over 2 weeks ago. So
Victories to come.
Exactly. I am confident that all it takes is 3 out of 296 board of supervisors, 3 in one county, to make that courageous decision. And I believe, Jeremiah and your listeners, once one board of supervisor decides, it'll have a domino effect, not only here in California, but throughout the United States.
I agree. So thank you again for joining us, everyone. Have a wonderful weekend. Thank you, Ronald Owens Jr. Talk to you soon. And everyone, spread the love and stay strong. Peace.
Thank you.
When you walk with open arms towards the sun, you feel the warmth of the rays, and then you know you're alive, and you don't have to be afraid of anything, 'cause you know the truth, and the truth is love, yes it is. Wasn't what they said to you, or anything that you learn from a book or from the news. It's not like that, 'cause it's a thing. It is something that you do. Doop 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 a doo. Doop 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 a doo. Doop 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 a doo. Dib on baby did long. Doop 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 a doo. Doop 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 a doo. Doop 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 a doo. Dib on baby did love's the highest truth. Nothing could be higher than love, my friend. Love's the deepest truth. Nothing could be deeper than love, my friend. When you stop and you take the time just to think about your life, you'll recall the ones you love and the ones who were always there for you. Better thank those friends better. You better make amends. Go and tell them now, yeah. Tell them what they mean to you. Doop 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 a doo. Doop 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 a doo. Doop 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 a doo. Dib on baby did love. Doop 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 a doo. Doop 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 a doo. Doop 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 a doo. Dib on baby.